Good morning. Hello, everybody. It's Candace here, your practice competency advisor, coming to you live from NHPC headquarters in Edmonton, Alberta. And today I have my esteemed colleague, a friend of mine, a fellow practitioner, and also a member of the board of directors of NHPC, Laura Finley. And Laura Finley has been a massage therapist for many years. She's been an educator of massage therapists for a long time as well. And today, as you know, we're going to be talking about that difficult topic about how do you end the therapeutic relationship, and how do you do it ethically and without so much strain that you're just scared to look at your appointment book in case that person sneaks in somewhere and then you have to deal with them. It can be really stressful. So we're going to try and shed some light on that today. But before we do that, Laura, I just wanted you to, say hello and any other, anything that I missed introducing you that you might want to.
Hi, everybody. No, I think you probably covered everything. I'm coming to you live from my dining room. I'm happy to be looking at the sunshine today. I have been practicing since 2007. I also taught for a number of years. I worked at the NHPC and I'm currently on the board of directors. So I feel really fortunate that I've had a really kind of full circle view of the industry. Um, but I am continually learning as well. And I think that's one of the great things about the profession is we are always learning, always growing. And we are humans and we sometimes make mistakes. But we, atone for those and we move on. So it's just been a wonderful profession for me. And I'm really happy to be joining Candace today.
Yes, great, great. So, those of you that are watching on Facebook, you can definitely, type in a question and it will get to us, and we will be able to address those probably near the end of our chat today. And if not, you're always welcome to contact the NHPC office later, and get in touch with me, and we'll, the usual ways that you get a hold of me are still absolutely in place. So we hear a lot today or these days about ghosting and gaslighting and these things that might seem like they're more in line with a dating app or something, but really when it comes to I'm not that into you, it's not you, it's me, all those sorts of things, it also it can fall into in your profession, in your clinic. So here's one of the things that we do get asked here at NHPC, and we just want to give you guys some options again about how to deal with this. But I just can't, I don't want to treat this person. We don't jive. They never listen to any of the um, help I try and give them. They don't do their homework. They're not compliant. They keep just continuing doing what's causing the problem. They're not taking any interest in their health care. I don't want to deal with this person. So, can I email them? Should I have a chat with them? Should I let my boss do it? What if I don't have a boss? Let's start there. What do you think? If there's somebody that is just not, they're just, well, I want to say they're not the ideal client because everybody goes through this where
Sure,
they're not following directions or whatever. But after a
sure,
while, it's like, look, buddy, you're just keep hurting yourself and you keep coming here thinking I'm going to fix you.
right.
So I feel like I'm wasting my time and you're wasting your money.
For sure. And I think we've all had those clients who may not make their own health the kind of priority we think they
We'd
should.
want to.
We
Yeah.
offer them home care. They admittedly don't do the home care. They have kind of a negative connotation about, whatever they're feeling in their body. So we as therapists sometimes may feel like we're just continually beating our head against the wall. But by the same token, they are still coming. They are obviously getting value from the treatment that we provide. And, I think it's important to recognize where they are at and meet them where they are at.
That's a good point.
And sometimes that relationship develops over time. And, I have had to develop the ability to meet them where they're at. That doesn't mean that I'm not going to continue to offer suggestions that they can follow in terms of their own home care. But I try to tailor those suggestions to what I think they're going to be able to manage. And not everybody has the same view of remedial exercise and home care and the
Exactly.
benefits. They're busy, they may have children, they may be a little older, and they may be in chronic pain. And that's
Yeah,
one thing that we sometimes forget is when you are in chronic and possibly constant pain, you may have very limited capacity, both mentally and physically, to take the steps that we as therapists think that they need to take to, recover. Maybe they can't recover.
yeah, that's
So
true.
again, one of the best things that I've learned is to try to meet them where they're at and manage them in that space. And that's been very helpful for me.
Yeah, that's fair. That's fair. I think as frustrating as it can be, you're right. People are people, right? But the fact I thought I could touch on a really good point there that they are obviously seeing enough value in what you do that they're coming back to see you. So,
For sure.
maybe eventually you can crack that nut sort of thing and you get them
Yeah.
to be a little bit more compliant with some of the things that you've laid out. But unless it's really extreme, I would say just continue on doing what you're doing. But what
Well,
happens,
and the other thing too, it comes down to, what are the client's overall goals for treatment?
right?
Sometimes the client's goals may just be, I want to feel good, I want to relax, I want my neck to feel better. And those are their goals, and our obligation is to address and meet those goals. I had a client the other day that I have treated for many years. She has chronic neck pain. She has arthritis in her neck. She came in the last time and she said, "Oh, my neck's just been so sore." And I said, "What have you been doing at home? Have you been putting heat on it?" "Well, no, not very much." And if I had a nickel for every time she and I had had a conversation about putting heat on her neck. But by her own admission, she hasn't been, and that has to be okay. She knows that's beneficial for her. She knows that I'm going to, continue to suggest that, and
Yeah.
she's got to pick up what I'm putting down. And in the meantime, we meet in the middle, and um, you know, I
Yeah.
provide the treatment that she asked me to provide.
Yeah, exactly. I think that's well said. Yeah. Let's move on to another one where um, let's say there's a person that is borderline inappropriate. They're crossing boundaries with you. They're perhaps you might feel that they appear to be um, developing some sort of feelings for you in a or codependency on you, and that you really feel that you've got to we've got to stop this, we've got to stop this because I'm not able to to keep my professional boundaries with you, and you're not able to keep your boundaries with me, and things are just not going the way they should. So I don't know if you've experienced anything like that, but we do get um that really close to boundary crossing, even if it's in a real negative way. I mean, it could be in a sexual way where it's like full stop, or it could be even in a nobody listens to you, nobody's like you, I really enjoy our time and maybe I could take you out for coffee, or how could I pay you back, that sort of thing. I mean, that we just got to put the brakes on that sort of stuff.
Sure, sure. Every situation really is unique, and I
It is.
think to try to deflect it and not address it will just likely mean that it will continue to happen.
Exactly.
I
Yeah. Just
always try.
avoiding the conversation is not, just hoping they don't book. Just, telling the front desk, tell them I'm busy, I can't see them. It
For
just
sure.
doesn't work.
No, it doesn't. And, you as a therapist, you have to, ask yourself, is there intent, or is this something that is just, maybe they just don't really understand that, these comments are inappropriate in this setting. I do like to give people the benefit of the doubt. But I think it's also appropriate to, be open and have a conversation and say, some of these comments aren't appropriate in this setting.
Yeah.
So we can't have those kind of comments in the treatment room. And I think some people may just not understand that and say, oh, I had no idea, I'm so sorry. And
Yeah.
that's kind of the outcome you want to have. But I think it's much better to be upfront and professional, and let people know what the situation is and what the appropriate behavior is, because like I said, some people may just be coming from a place of feeling uncomfortable, especially if it's someone who really hasn't had body work or massage before. So
Yeah.
I try to look at it from an is there intent perspective. Is there a connection that's not being made in terms of, do they know that this is inappropriate? Maybe they've had physio before, and physio is in a wider open space, and in a close confined space, we need to have, a better sense of self and a better sense of boundaries. And maybe they,
Mhm.
just need to hear that and, check that box and then move on. So.
Yeah, I think so too. And I think it's important. I mean, not nobody knows exactly. Like we were talking about this before we started today. Is like every massage, every treatment is different. People don't know what they're getting themselves into, for lack of a better term. So it's very important that you want to talk with them before you're even in the treatment space, before they've undressed, before they've done anything, that this is how I do things. These are the areas that I'm going to be addressing. This is how and why, so that they have a chance to go, oh, okay, so this is what this is like. And then so they're not in the middle of it questioning your intention, their intention, and I guess sort of wondering what they've got themselves into. So if you've got, that rapport from the beginning of how things are going to go, then that can also often, you know, stop that, boundary crossing, because, you certainly, you wouldn't talk that way with your dentist or your doctor, or that wouldn't be sort of tolerated there. So just because of the setting we're in, if you've laid it out from the beginning that this is what this space is for and how we're going to do things, that can also help with that, the person.
Absolutely. And that's such a good point, Candace. I can't over state the importance and the value of informed consent. We learn in school the steps and the criteria for informed consent, but really this underlines the importance of it, especially when you're treating somebody for the first time. If you approach informed consent with professionalism and appropriate boundaries, the client should be getting the sense that that is the context of treatment and approach in the treatment room. And I
Exactly.
think if you approach consent with a bit of a more cavalier perspective, then
Hmm.
the client will pick up on that.
Yes.
And, I think consent needs to happen every time, because their needs may change every time. But that is why it is such an important part of the treatment, because it really sets the tone for behavior in the treatment room.
Yeah, absolutely. Absolutely. And there's another thing that's been brought up in the chat is inappropriate behavior. Um, may, well, what can be misread as inappropriate behavior could sometimes be cultural, because massage is different in different parts of the world, and what's sort of expected, or what the protocol is entirely different. For example, if you're doing Thai massage, the practitioner is on the mat with you, and they're using their body weight on you, and there's lots of things that are going on that wouldn't happen in a Swedish massage technique sort of thing. So I
Absolutely.
cultural understanding where somebody is coming from from the cultural perspective is really important. It all comes down to communication.
Absolutely. And, again, it goes back to consent. One of the elements to consent is the approach to treatment, level of undress. How will I be contacting you? Where will I be draping? Especially for someone who may not have had that type of treatment before, or may be used to receiving treatment that is clothed. We have to be very specific about describing how we're going to approach them and what those boundaries are, so that number one, they understand, the scope of the treatment, but also so that they can consent to it as well.
Mhm. Okay, so let's talk about we've got to end. We've chosen to end this therapeutic relationship. And so, is it okay to do it by email, by text? Is it okay should you have a chat? Do you want somebody in the room with you? What's the proper way to do it? Now, we're in a non-regulated environment here,
Sure.
which means that at this point, we don't have to, take their file and transfer it to another provider, or, regulated health provider.
Right.
So we're not going to worry about that at this point, which that could come into play once we're regulated.
For
Um,
sure.
but but let's just talk about we're ending this relationship for whatever reason. How do we do it? What do you feel is the best way?
That's tricky. And I'm not trying to deflect. I do believe it can be really situational. It depends on the reason why you want to end the relationship. Um, I'll give an example. Perhaps you have a
I was
client who wants.
I was going to say that they're chronically late. They don't show up.
Sure,
They're using up your time. They're booking appointments far in advance, not showing up.
sure.
They're one of those people. Let's use that for an example.
Okay, yeah, that
Good
is a good
suggestion.
example. I think if you using that example, if you're at the point where you feel that you need to end the relationship, hopefully you have had conversations that have led up to it. Um,
Yes. Yeah.
Unfortunately, you have been late a few times, stressing the importance of, we need to be able to start on time so that we can end on time, so that I can get ready for the client ahead of you. Remind them, ask them if they
Respecting
can commit
time. Yeah.
to being on time. And, if they're habitually unable to do that, then I think it's fair to say, we can't continue this way. We've had conversations about this. You've indicated that you would be able to, be on time and respect my time. And it doesn't seem like you're able to do that any longer. So, because I have other clients that I need to serve, and because my time is important, I'm going to ask that you, not be a client of mine anymore, or I'm going to request, or, I am making this decision that I can't have you as a client anymore. But I think in that situation, I would be hopeful that we would have had a conversation before
Exactly.
then,
Yeah.
before it gets to the point of needing to sever the relationship.
Yeah, exactly. But it does happen. There's people that no show, repeatedly. It's also helpful to have a policy about that, because then you can kind of
Absolutely.
say, well, look, I told you about this and you didn't. So guess what? You're out.
Yeah.
And that can give you a little bit more backing, sort of when you have those conversations. That look, you can't just keep doing this, and I think it's disrespectful of your time and my time. So because let's face it, we're all trying to make a living, and they're booking time out of their day to come. Obviously, they're mismanaging their time, or whatever happens. There are times when people are late. That's just the way, especially now. It's
Yeah.
minus 28. The car didn't start, whatever it is. that can happen, but that habitually, chronically late or canceling or no showing, yeah, that's a valid reason to say, you're just not respecting of the policies and what I have in place in my clinic.
It is, and I think it's acceptable as a professional to say, my time is not respected. You don't respect that aspect of me as a healthcare professional or as your
Yeah,
therapist. So unfortunately, I'm no longer going to be able to have you as a client because of that disrespect. I can't fully treat you with this not being a two-way therapeutic
very
relationship.
good. Yeah, very good. Now, what about the boss says, too bad, they want a massage, they want a treatment, you've got to give it to them. And you don't want to treat this person, you feel they're, it, you kind of just get the ick from them, or you feel like things could get inappropriate, or some other reason, but the boss says too bad and you've got to do it. So you're an employee, and how do you handle that?
Boy, there's so many factors that go into that. Am I an employee? Am I a contractor? I'm
Right.
a member of an association. I have a code of conduct and a code of ethics that I
Yep.
have to, as a therapist, um, adhere to. Do I have an open enough relationship with my boss, my clinic
Yeah.
owner, to say I am not comfortable treating this client, and as a contractor, I'm requesting that I not
That I
be
don't, that
asked
he
to do
doesn't
that.
show up on my, they don't show up on my appointment. Yeah.
Yeah. And again, it comes down to communication. And, if you have that kind of relationship with your clinic owner, I think that means you have a positive relationship overall. Um, if the clinic owner is asking you to do this one time, go back to the relationship with you that you have with the client, or why you feel kind of that hesitancy in treating that client. Is it because you had a negative experience with that client before? Is it because you felt that you didn't meet their needs? And I think that's fair too. I've treated this client
Sure.
before. I don't feel like I meted their, or that I met their needs. I
Yep.
think their needs might be better met by someone who has a different style, and that's okay too.
Yeah, that's absolutely okay. Now, what about those folks, we've got the policy in place for cancellation fees, or they've signed they've agreed to abide by the policies, but now when it comes down to it, that, look, I'm trying to capture a cancellation fee because you didn't show, and they're kicking up a fuss about that. And again, it's sort of it's the business aspect of our job sometimes that we have to engage in. Sometimes if you're working somewhere, they've got a front desk that might be doing that. But
Yeah.
when it comes down to, you know, you knew about this, now you're kicking up a fuss and you're giving me bad reviews and you refuse to pay, and you're causing a scene. Ah! Yeah, that's a good reason too to say full stop. We just don't want your business here. Thank you.
Yeah. Yeah.
You know,
And if it does come down to that, hopefully you have a clinic owner who is supportive of that. And
yeah,
sometimes the clinic owner may choose to be the person who communicates that to the client in terms of, we don't want your business anymore, which is different from, I don't want to treat this client anymore. Maybe this
exactly,
person is better served
exactly.
by somebody else in my clinic who has, different skills, different experience. Um, in terms of, cancellations and cancellation fees, I always tend to think that if I assess a cancellation fee, especially if they've missed one time and it happens to be their first time, I have very little opportunity to capture that client again.
Yeah,
But, I'm totally fine with saying, I realize that cancellation sometimes happens. Our policy is to assess a cancellation fee. I'm going to waive it this time, but I won't be able to waive that,
again, yeah,
in the future. So, and, I've also had clients who willingly said, please charge me. And there have been times where I have, depending on the situation, and times where I have.
sure. Yeah,
Yeah,
and I think that's just, um, that comes with experience and, um, you know, I guess whether or not you're on your own in your practice or not, it can be helpful to deal with those sorts of situations when there's somebody else there to help you. Absolutely. So
for
I think
sure.
a lot of folks do get into this profession thinking that it's the ultimate thing I can do by myself out of my home. It's low overhead, it's this. But then one of the things that you have to deal with is everything, meaning, the client that isn't paying, or the client that is problematic, or there's nobody else to sort of fall back on to have those. So that's why it's important to have strong policies in place, because like I said, you can always go, oh, guess what, you signed this, and that it's on the wall in my clinic room, you knew this was going to happen. So if you're not going to pay it, then you're going to have to find yourself another provider, because
Yeah.
I'm just not doing it.
Yeah,
So
and
did
and I think it's fair to say, I'm not in a position where I can continue to hold this space for you, and not be compensated for it.
Yeah,
As someone who is in business.
yeah, yeah,
Yeah,
exactly. I uh there was a doctor's office that I used to visit, and they had a sign up about all the missed appointments and how many other people could have got in because of that. And it was just like, it was a large clinic with quite a few, professional practices in it, but
yeah,
it was crazy. And and then so there's people that are waiting and waiting and waiting, perhaps, and you just didn't show up for what. There's always reasons. I'm not going to say that there wasn't good
for
reason for
sure,
not show up,
for
but it
sure.
was in the hundreds, kind of thing,
Yeah,
that of how that was going. And you're right, at certain time you have to say, my time is valuable. As what we do, we really get paid by our hands being busy. So
yeah,
if we're not busy, then that revenue isn't coming in.
yeah,
So it is you do have to have sort of hard line boundary about respecting that time,
for
because
sure.
it is time away from you, waiting for somebody else when there could have been somebody else on the table, or
Yeah,
time is money in some cases. This is one of them.
yeah. And sometimes an approach of thinking that the client genuinely may not know, what the impact is. An
Yeah,
impact to the client may not recognize that their behavior may be perceived as inappropriate. The client may not know that, time and missed appointments is critical, because we generally work on commission. So I go in with that perspective, thinking they may not know. And if they're continually repeating behavior that is unacceptable behavior, and I don't bring that to their attention, then I'm not helping them. So
exactly.
so I
Yeah,
feel like I need to make sure that they do know that either their time boundaries are inappropriate, their personal boundaries are inappropriate, because if they don't know, maybe there just needs to be that one
yeah.
conversation, and then it never
Yes,
happens again.
that was the perfect way to sum this all up, because you can't assume that people, well, they know that if I'm late, then this person's late, and then my day's ruined. No, they don't. Nobody knows that. you
Well,
know
and they
or
and they
nobody
may
knows
think
that
that
it's inappropriate in the treatment. Not everybody assumes it's what's inappropriate in the treatment room to talk about,
yes,
or
yes,
to ask about, or to start undressing in front of you, or whatever.
right,
If you don't know what they don't know, so it's really important to have that conversation, because
yeah.
then you're both sort of blind about what's going on, and that's never a good thing.
Yeah, and we all know that if the client doesn't show up, then we don't get paid. But they may not know that.
Yeah.
So, you don't know what they don't know. So
Yeah.
it's our responsibility to make sure that they know what is important in the context of them being a client and us being their therapist.
Yeah. And I've had a interaction with somebody who assumed that massage went a certain way, and that it was a male, and they assumed that things would end up ultimately in a sexual service. And I told them no, and I explained to them that that's not the way that I do things, or that we, do things. Please get dressed and leave the clinic. And they
Yeah,
waited out in the area, in the front area for me, and we had a chat. And this person genuinely did not understand. They thought that's what massage was. Their only interaction with it had been on that level, or in that lane
right,
of
right.
of of non-therapeutic massage. So
Yeah,
again, they were very apologetic, and they were very embarrassed, but they didn't know. I mean, and some people watching me right now go, "Oh yeah, they knew." Maybe, I mean, whatever. But this gentleman was actually quite, we had a valid conversation about it. And again, this wasn't my first week of work. I had been doing this a while before this happened, so I had sort of the guts to have a chat with them,
sure.
because usually it's very embarrassing, and you just want these sorts of things to end. You don't want to ever see this person again. Get out of it,
Right,
you know.
right.
But this just to reiterate the fact that people come from where they come from. People have ideas about how things are going to be. If they're not educated on it, if they're not, if you're not telling them what happens in my treatment room, then how do they know how to act? They
Yeah.
just don't. No.
Well, and as you were talking, it really brought up the point of whatever the conversation is, it potentially can be a difficult conversation. And I
Yes.
think as long as we can maintain our sense of professionalism, not as best we can, bring emotion into it and not bring judgment into it. Whether it's an issue of time or, breaching a personal boundary. I think if we can have that approach to say, uh, this behavior is not acceptable in this context, and I cannot have it anymore.
Yeah.
You're
Full
being
stop.
professional. You're not imposing judgment. You are indicating that your habitual lateness is not acceptable, and
Yeah.
we can't have it anymore.
Yeah. Yeah.
So
Yeah. And again, it takes it. You got to have some courage and build up your confidence. Make yourself big. To do this. If you want to, I've had conversations with members where there's like they just want to practice it out. So we did a bit of role playing over the phone. And if you've got somebody else in your clinic that you could do that with, that's great too. Because it's hard.
it is.
We're ultimately we try. Generally people are polite, so they don't want to bother you and ask this question, or they don't want to assume the wrong thing, so they just don't do anything, and then we're all sort of left in the blind. But
Yes.
just confident, calm communication, and coming from a place really of, I just need to say this so that you
Yeah.
understand and we can talk about it.
Yeah.
Really
And
helps.
I think that can be done without imposing blame and without
Yeah.
imposing judgment. Instead of saying, you have plenty of time to get here. This happens all the time.
You've got a
What's
Starbucks in your
wrong with
hand,
you?
so you were on. Yeah.
Sure, sure. I think perhaps a better approach, is, we have certain responsibilities. My time is important. I know your time is important as well. But this situation is untenable, and we just can't have it anymore.
Yeah,
Yeah.
I think that's great. I was just going to look in our chat. There's lots of people are talking, or they're chatting about, the no shows and the cancellation fee, and um, and that sort of thing. So that's good. Um, how do I deal here with a client who is bringing in their children with her, a 3-month-old and a 4-year-old, because, there's no other place for them. I guess she needs to bring them. It's frustrating. I don't want to be offensive, but I have to tell her she can't bring the children. I mean, yeah, I think it's also, time for her to be hopefully having some time to herself, which can be
Right.
very difficult when,
Right.
as a mom. But that's also, what the policy is in the clinic about anybody else in the treatment room. It could be the
For sure.
mother-in-law, or it could be,
Yeah.
a husband, and culturally speaking, maybe that's something that can happen. But when there's distractions like two small children, that can be really difficult.
That can be difficult, and it can have an impact on other space in the clinic. So, some clinics may have a policy about that, and in that case, you as a person working in that clinic have to abide by the policy. So, in that case, it's a straightforward explanation. We have a policy in this clinic that we know we can't have children in the treatment room. Sometimes again, it can be situational. I've not personally, but other people in clinics that I've worked at have had clients come in who may have a 5-year-old, and they bring a coloring book, and the 5-year-old is able to, color and be minimally, interruptive. And in that case, that works. I think if it was, a small baby and, a toddler, that's very difficult. And in that
So
case,
how do you say without being offensive to them that, this is just not appropriate? Maybe find somebody else to treat you.
yeah. Yeah, I just, I think in order for you to receive the best treatment, are you able to find somebody to care for your children? We're just not in a position here to accommodate that. I think sometimes we need to remember that we can say no. It's very hard
Yes.
for us sometimes to say no because we want the client, we want to be of service to the client. Um, but I think sometimes in especially this situation, I think it is okay to say we're just not able to accommodate that.
I think you're right. I think it can be disruptive. I mean, it's hard for the therapist to do their best work as well. It's
Yeah,
it's definitely, this person isn't being interrupted by the child, or especially if it's a sometimes if it's a teeny tiny one that can sleep the whole time, that might be okay. But
yeah,
still, yeah, I think you really have to say, that we just can't accommodate this. Um, you know,
yeah.
Oh, some of them, maybe that's a way to get in. That's a new business idea, to have a massage clinic that's
On-site
got,
clinic or on-site daycare.
it's
Yeah.
got a childcare spot for that, so mom can have this and the kids are busy for 90 minutes or whatever. So that's not a bad idea. Okay, so I'm just going to check here.
I
Now,
saw somebody I saw one of
yeah,
the things go by, and I'm not able to see it right now, but the context was, when do I allow a no-show? When do I impose a cancellation? When do I know when to when to let something slide and when not to? And
yeah, and
I think there was a question or a comment in the
sure,
chat.
that's yeah. We can talk about that. If is there a sort of a hard and fast um is there hard and fast? Well, if you miss one time or two times, that you can set those policies in your clinic. You
Sure
absolutely can be.
can. Yeah.
If you and there are some places that it's very hard line because they're very busy. And that's just it, full stop. If you're not here, we're charging you. And this now another thing, just as an aside, a fee cannot be charged through the client's insurance plan.
No.
They do not pay for missed fees. They won't. You do not bill that. That has to come right out of the client's pocket. And
It does.
really, these policies are set as a deterrent. Hopefully they're not something that you're actually having to do a lot, because then obviously that person is just not the things are just not jiving there with you. If they're continually, months later, just you have to question why they would be paying all these fees and things. But
Yeah. Well, and you know, that's another thing too, is we know that we can't bill a missed appointment to the client's insurance, but I like to make the assumption that the client may not necessarily know that. They may think that that's
Exactly.
perfectly okay.
Yeah,
So that's an opportunity for me to educate them and say, your insurance exists so that you or we can get reimbursement for treatment that you have received.
exactly.
We cannot
That's
bill
it.
them for treatment that is not received. And some people will say, oh, I didn't know that. But
Yes,
you know, um, and I think, you know, it's situational, and every therapist has their own view on imposition of no-show fees, cancellation fees. Some are very one and done, and that is totally okay, as long as that's in your policies and as long as that is, you know, enforced for your clients. Some people have a more lenient approach for
yeah,
a
like
number of
three
different reasons.
strikes or whatever. Yeah,
And I think that that's, you know, fair to say. If your policy is, you know, you have three strikes and then, you know, I'm going to charge you. I don't think most people will take advantage of the fact that, you know, they have three
no,
strikes. You know, I like to think that most people are well intentioned, but if we continue to let that kind of behavior go on, it really is kind of up to us to, you know, have the boundaries and have the
yeah,
communication to say this can't continue.
yeah, I agree. Is there any other bits of ending client relationships that we should talk about? I think it's important that you note it in the client file, absolutely, that,
Absolutely.
this was, the reason, and this is how I handled it, and that, so that it's in the client file, and because you're keeping your client files for 10 years, that's always in there. If anything ever comes back to question or something, you should do that, and it just sort of closes it off too, then that you've done that. um
Well,
so
and it does highlight the importance of documentation and charting. So if you're in a position where you have to say to the client, you are habitually late, we've talked about this, you agreed that you know, you would be on time and you're still not on time. I think it's important, you know, to be documenting this, and I have documented when a client has been late and I've had to start the treatment late. And, you know, I've let the client know, you know, we're running a little bit late because you arrived late. So we're going to be starting the treatment late. Um,
yeah,
it's really important to have that, you know, in your client notes. You know, that is part of the treatment. So
yeah, for sure. So I mean, when in doubt, write it out, I guess, is one of the things we can do. So I want to thank you very much for joining me today, and I hope that we've helped some people at least think about some reasons why, why they, or not some reasons, but get some ideas about how to better handle that, ending the client relationship, and realizing that, there are always two sides to every story, realizing that not everybody knows the ins and outs of, how you're running your practice. So how could they possibly know how important it is that, you actually show up on time and that sort of thing?
and the importance, I think, of having conversations without emotion and without judgment, if you're able to. And
Yeah.
if it is a really extreme situation, don't hesitate to, you know, have somebody else there with you if you feel you need that support.
Yeah, absolutely. And I think, we know that letting things slide, letting things go, or just hoping that they sort of get the hint that I don't want to treat them anymore. It's just so stressful to live in that. So do yourself a favor and not do that. Have the conversation going along, and let them know that, this is not appropriate. Having your own, you know, setting your own boundaries about some of these things is really the first step. And it takes a little bit of time to do that. So
And I saw one of the comments, and I'm not reading it back verbatim, but I
but
think somebody in the comments said that they prefer to have grace with people, and
yes,
that is very common in our profession. And I definitely like to take that approach too. My approach is always to be in it for the long haul and to develop a relationship over time with the client. So definitely, I know that there are times where they are struggling. And so during those times of struggle, I definitely like to use the term, give them grace. It's just a matter of making sure that you have open communication and maybe saying, I'm understanding that you're, really, struggling right now. And
yeah,
I understand that, that may be, why you're late, or why you're, not really treating with it, having the same importance that you normally do. And I hear that and I understand that. And, I want to get back to a place where, we're both on the same page. So I definitely heard and resonated with that comment. Um,
mm,
and just, be open and communicative with people about it.
yeah. It's the way to go for sure. We know that breakdown of communication can be, you know, that's the sort of the start of things sort of falling apart on a lot of levels. So
Yeah,
okay, so we're at our 45 minutes here. So thank you very much for joining me today, Laura. And like I said, anybody who wants to discuss this more or has any other questions, please feel free to email practicemanagement@nhpccanada.org, and myself or my colleague Roberta, one of us will have a chat with you about it, and hopefully we can alleviate any stress you're having about it as well. So we'll do our
for
best.
sure.
Okay.
Candace and Roberta are definitely, great sources of information and suggestions and guidance. So if there's anybody out there who feels that they need to have a conversation that they just don't know how to approach, you've got a lot of support.
Great, great. Thank you very much. So signing off here from Edmonton NHPC World Headquarters. We'll see you next time with another topic. Thank you.
Thanks, everybody. Bye, Candace.